The federal government has clarified that providers may not charge patients for the COVID vaccine for the duration of the public health emergency. It's thanks to Operation Warp Speed, that partnership to develop and distribute the vaccine. Because of Operation Warp Speed, the federal government purchased hundreds of millions of doses of the COVID vaccine, and these are being distributed to providers at no cost. Therefore, providers can't turn around and charge patients for the vaccine. They can technically charge to administer the vaccine, but what the federal government is clarifying is that insurance should therefore pick up the cost at 100% of administering the vaccine, whatever that looks like. And again, that provision is in effect as long as there is the public health emergency. So if you're somebody that has private insurance, Medicare, Medicaid, or even uninsured, this vaccine and its administration will be covered. Here's actually some of the language that the Centers for Medicare and Medicaid Services shares in their recent memo. If you have private insurance, it says that your private health insurance will cover the vaccine and its administration. Plans subject to the Affordable Care Act's requirements will also have to cover vaccines administered out of network. Medicare covers the vaccine at no cost sharing, and this is actually covered through Medicare Part B, not through Part D, it's through Part B. Medicaid must cover the vaccine with no cost sharing as long as your state is getting that enhanced federal match, that FMAP, that enhanced federal money. People with limited Medicaid are not necessarily covered under this requirement. They will, though, be treated as uninsured, and uninsured individuals are not charged for the vaccine either. People that are uninsured will have their providers seek reimbursement for administering the vaccine, billed to the federal government, not billed to the uninsured person themselves. This is similar to the way that COVID testing was handled through a separate arrangement. The administration of the vaccine will be handled the same way. So the goals that the federal government was clarifying in the recent statement was, first of all, the goals of Operation Warp Speed, which was to produce and deliver over 300 million doses of a safe, effective vaccine. The Centers for Medicare and Medicaid Services echoed their goal is to increase the number of providers that can actually administer this vaccine while also ensuring adequate reimbursement in Medicare. The federal government said, we want to make clear to private insurers and Medicaid programs their responsibility to cover the vaccine at no charge to beneficiaries. We give you some resources in the description below, the final rule talking about insurance coverage for vaccines. We also share CMS's website where they give this clarity of language about how these vaccines and administration should be covered. The Kaiser Family Foundation has a really detailed issue brief that goes into more depth on vaccine coverage through the various healthcare coverage programs.